Hello, this is Optimum Health For All. I'm your host, Ode Odell. Today, we're going to talk about depression. Depression, I'm sure a lot of us have heard about depression and what havoc it can cause, usually among persons and in the community, among families, and among group of friends. Depression is not something that we should joke about. It's serious business, a serious illness, and we have an expert with us today that's going to talk about depression. Everything we need to know today. We have Professor Princewill Stanley. Prof, you're welcome. Today, we're talking about depression.
Yes, sir.
What is depression?
Thank you very much, sir. Like you said, this is a disease condition or an ailment that is often neglected, but brings about tremendous discomfort to the person that suffers from it, to the members of his family, and to the general public, including his place or her place of work. Depression simply means a psychiatric condition which is often characterized by three major symptom complex, which includes mood, which can be depressed, irritable, like in the younger people, or agitated for the elderly persons, followed by loss of interest or lack of capacity for enjoyment, which is often referred to as anhedonia, and now lack of activity, and also the inability to do anything based on low energy perception. These are the three core symptoms. The others include poor concentration at work that leads often to low productivity, and also poor sleep, poor appetite for both food and sex. Usually for those who are married, that's what we say. Then we have persons who also feel nihilistic, as if nothing is in them. There's also this feeling of guilt for doing nothing and a feeling of hopelessness and pessimistic thoughts. Pessimism, when somebody can never be optimistic in anything he or she does. Somebody can do an exam and say, I've already failed. Don't bother yourself. And he tells you that he's failed, he's not bothered about it. These are the major symptoms of what we call the normal presenting depressive illness. However, you can also have what we refer to as atypical depression. In atypical depression, instead of them to have difficulty with sleep, they usually have excessive sleeping, which we refer to as excessive somnolence. They can also have hyperphagia. They will have excessive appetite instead of lack of appetite. They can equally have desire for hypersexuality instead of the other one of not having interest for neither food nor sex. So these are the common symptoms that present whenever we talk about depressive illness. Of course, the cognition is affected. There's what we call negative cognition. That's why they feel they're a failure. The world is so wicked, and there's no need for them to make effort in life. What we call the cognitive theories, negative cognitive theories of depressive illness. Depression accounts for illness of about 322 million people in the world, which comes to a general global population of 3.9%. But if you go by age ranging, depression is about 26% for adults and middle-aged elderly persons. 26%. while the young adults have about 25%. Then, due to displacement, those who are found at IDPs, the internally displaced persons, range from 17 to 30%. It could be accounted for by stressors of life, what we call persistent stressors of life. So this is actually what depressive illness is all about. And if you are looking at our article of diagnosis, the Diagnostic and Statistical Manual, you can all having what we call the IC, the International Diagnostic Documents. You can refer to it as a major depressive illness. And when these symptoms occur after the first time, it's now referred to as recurrent depressive illness.
Okay, so you've described extensively what depression is, how it presents, and how it can be recognized. But who makes a diagnosis of depression? Is it, can lay people say this is depression, or it has to be confirmed by a doctor?
Thank you very much, sir. This is a very interesting question. The diagnosis of depressive illness should be the common concern and responsibility of all, because that's why we are talking about the mental health gap closure program, whereby you make it very easy for those, even at the grassroots, primary health care, to be able to identify depressive illness.
So it's just once you can recognize it,
Yes,
go
sir.
to say this is likely to be depression,
Yes, sir.
and then take the person to hospital.
That is true.
Okay, so you don't have to second guess. You have to say, well, it's likely to be.
It's like,
I have to go and see a doctor to be able to see what to do about it.
yes, sir, that's quite correct. But before then, the clinical psychologists or counselors can take one up if a possible diagnosis of depression is suspected. And after 3 weeks to 4 weeks, if there is no improvement, there has become the need mandatory for the person to see the specialist.
Okay. So if not, when a doctor, a clinical psychologist has handle depression, unless there is a compelling need to see a attack. Is that what you are saying?
What I'm saying, sir, yes, both ways. Depression can be managed at the primary level, where you hardly see consultants. If it's not responding, depression can equally be handled by even ministers of the gospel. If it's at the mild level, they do counseling, where counseling, the person is well trained in counseling activities, motivational interview, cognitive behavior therapy, which is done by the clinical psychologist. But if this fails, there is need immediately to move to the secondary facility, where the general duty doctor can intervene immediately. And if it fails, or you are not getting a rewarding response to treatment, every need has arisen for such a person to be moved to the tertiary institution for the expert, the psychiatrist, to take over the management.
It's very good. Now, how do we manage depression? What has this done? So the testings have pictures as they have described, and so those that detected or no. What can be done for them?
The truth, sir, is that the management of depressive illness is in threefold, what we call the biopsychosocial approach. The bio is biological, which will include investigations because of associated conditions, physical conditions that could result in depressive illness, and also the oral drugs or injectables used, you can now go to the cycle is the psychological impact of treatment, which attracts the psychotherapies, cognitive behavior therapy, or counseling. Then the last phase is the social aspect, which includes the treatment by social work staff, who usually will do home dressing to see whether there are stressors that actually bring down the person's mood at home, or to understand the social dynamics that the person is going through, whether he or she has what we call confiding relationship in marriage, and if he's single, what of the siblings and other persons, are they relating well? Is the environment toxic enough to sustain the symptoms of depressive illness? That's where the social worker comes in. So these three must come together to give the person a holistic output in the treatment of a depressive illness. So it's not only the doctor with his drugs, it's a holistic approach which brings some other experts, the social work staff and the clinical psychologists, the counselors who are trained for mental health, then the doctors who are psychiatrists. So what I can understand is that the multidisciplinary approach, those have to be a group of performing, yes, and they are all right. Somebody at the platform, yes, of here to how is the I don't know that possibility. If the person that will be first, the game managed, how cover completely with any other mental illness, and it causes any other problem on the body, it was depending on treatment. Yes, sir, it depends on what has brought about the depressive illness. You know, in the etiology, we look at the genetic component, possible causes of depressive illness. It could be genetically endowed, inheritance. It could also be due to some hormonal changes like thyroid function. Hypothyroidism goes with depression. Cortisol disorder, whether hypercortisol or hypo, can cause metabolic disorders. In fact, we also have a high association of depression with cardiovascular conditions like hypertension and cardiomyopathy. Yes, sir. Heart disease. They can solve any chronic disorder. Yes, sir. Can result depression. And use of drugs of abuse. Yes, sir. Can they become depressed? Yes, and why would they become depressed? So you know, most of the times, the depressive symptom can occur soon after delivery because of obvious changes that go on within delivery and the hormonal changes. You know, the estrogen drops significantly, and there is a rise of the progesterone and all the rest of them. The hormonal imbalance can be a result of depressive illness. But there are other issues that can increase the liability of a pregnant woman to become depressed. One could be the relationship. Is it a toxic relationship? There are women who go through, yes, there are women who go through traumatic experiences. They are bullied and physically assaulted by their spouses or friends, and that can lead to depressive illness. Some females, when they're pregnant, may have, because of cultural differences in our climate, where people will say it's a male child and what, and if the scan says, it's female, you will deliver, the person may become depressed. And infections during pregnancy can heighten the possibility of depressive illness. Poverty, that is socio-economic factors, can equally bring about depressive illness in pregnancy. In fact, it's been written that 50% of depressed population is constituted by women, and these women are known to have low income abilities. Most of them are not in any reasonable job, and most of them did not receive any reasonable education. So socioeconomic difficulty and poor academic achievement are very strong predictors of depressive illness, even with women. And some disbalance in the hormones during pregnancy has also been seen as a liability to that.
Okay, there's leading
Yes, sir, to depressive illness.
when a woman, pregnant woman is depressed, and after the injury, what normally happens? Why do we know that this woman is indeed depressed?
Okay, so you are now talking about the postpartum depressive illness after delivery. Yes. Previously, it was referred to as involution. You know, when it takes about 6 weeks for the uterus to return back. Yes, that's what was taught. But most now saw that beyond that, this depression continued. It's just like case of hypertension sometimes, or even diabetes that follows after delivery. Some of them may not return. Yes. This to normal, sir. And this actually also occurs in depressive illness. It may be a recurrent depressive illness that is being heightened by pregnancy.
Can just be
Yes, the pregnant factor. It could also be, that means there was depression in situ. There could be also depression resulting from the stressors of pregnancy. It could be, like I said, trauma, emotional trauma. It could also be a traumatic delivery experience when people have unduly prolonged or protracted or difficult deliveries, or now go into obstruction that now finally leads to an emergency CS. Unbooked patients, pregnant women, are more likely to present with postpartum depressive illness. You can check them after delivery than those who had a planned and elective CS that they say, this your pelvic is difficult. It cannot allow baby come freely. We'll do an elective CS. And when it's planned, they are likely to have a better outcome than those who went through such physical traumatic experiences.
Very much, and though I've learned enough about the person, including the special development personality after the game. Now, what can we do to prevent depression? Because the way it is now, human management takes a role from a group of people to consider nurses, social workers, and so on. So, how do we prevent this? Is it possible to prevent this? Because in this program, we are more concerned, but not that it's not fair by any others, but we really want to talk about prevention so that the possibility of having a disease or the natural mood of having depression, for example, will be reduced for the better and the most. So how can the systems presented? And again, probably that you know that if I do 1 or 2 people, I may not come.
Thank you very much, sir. This is what I will call a very strong synergistic collaboration. We have to be very intentional on these issues because depressive illness, like I said earlier, could be an emotional disorder. And there are factors that have been highlighted. If we say enduring stressors of life, it could be internally programmed. It could be externally programmed. It could be programmed by the person's genome. So if there is, yes, sir, different person, different way of reacting. If we have the what we call psychological hygiene, where people have enough information to say this higher stress level and balance. Beyond this, you may snag. It will assist. And if people are exposed to regular stressors of life, what we call chronic or enduring stressors of life, the possibility of a depressive illness is there. If somebody does not have food to eat and it comes regularly, and you say, go, and God will help you, and God will provide, that's mockery. That depressive illness will not go. But if there is a social service system where persons who are unemployed can have something to fall back on, it will reduce depressive illness. Remember, I said about 322 million people in the world have a depressive illness, and 50% of these persons are women, and 50 plus. And thereafter, you also have the young population of between 18 to 46 as being highly susceptible to depressive illness. And you check that these are the periods where persons are actively involved in daily employment activities and even to make a living. But if it's not available, the best opportunity will be to get a palliative in the interim and work towards making the person get a job. Yes, and that's why our social welfare scheme should be active to do what it's supposed, social welfare. Yes, sir.
Not yet. We don't really have
we don't.
Well, no, for the reform that they are I can find
yes, sir.
After the war.
Yes.
But beyond that, how did the right on the book are not looked after?
That's not correct.
Yeah, to that unemployment, poverty,
there are high risk factors, and there is nothing medication can do. There is nothing much the cognitive behavior therapy can do at this point. If they continue and you cannot get any tangible assistance, the pressures will remain.
And back to that one,
family support. Yes.
You recommend the extended family system?
So that's to say the least. And you will also agree with me that the prevalence of depressive illness and some psychotic disorders is higher amongst the Caucasians, among the whites who practice this very secluded family they call the nuclear family system. The Africans and the Asians have a cushion in the extended family system. Yes, sir. Yes, sir.
So you need that to practice safety net.
Yes, sir.
So are there any other advice to give anybody or maybe a family in find that your family member has because of depression? So what advice will you give in rounding up?
Okay, the advice I will give to those who have symptoms they suspect to be depressive illness should be by walking through your primary health caregivers and also reminding them of these symptoms, if possible, reminding them of the need to see the psychologist, the doctor, and the social work staff. And if they are not impressed or there's no significant response to these interventions, they should go higher to see the psychiatrist for quicker intervention. Yes, sir, and the proper resolution. But our churches remain a pillar of support for those, and the mosque too, for those who are the borderline or mild form of depressive illness, because they receive a form of counseling. Yes, sir, and also hope that gives hope that tomorrow will be better than today. But that may not hang on for a long time. So the government also has a very strong role to play by making sure that things are properly done, and then nation's wealth is equitably distributed, not going to the purse of one man who accidentally is found in the position of responsibility. Thank you, sir.
Understand it. Although found passion, if me does the and that stop the testing about the question. Yeah, that's no we thought the content of today's program. Thank you very much for healing. Please, as this always say, subscribe, like, and share. Thank you. Bye for now.